Hi everyone, welcome back to Eva Medical Series. I am Dr. Shailendra Kumar. People worldwide are living longer. Today, most people can expect to live into their 60s and beyond. Every country in the world is experiencing growth in both the size and the proportion of older persons in the population. As people get older, several physiological changes occur in their bodies. Physical changes due to aging can occur in almost every organ. As people age, they are more likely to experience several health issues. Many illness and conditions occur more frequently in people as they get older. Benign prostate hyperplasia, otherwise called prostate gland enlargement, is the most common disease among aging males. It is reported that prostate gland enlargement occurs in 50% to 60% of men aged more than 40 years, and its prevalence increases markedly with age. Globally, the estimated incidence case of prostate gland enlargement in 2019 was 11.26 million. Prostate gland enlargement is characterized by a benign overgrowth of prostate tissues surrounding the urethra that ultimately constricts the urethral opening and is associated with lower urinary tract symptoms such as urgency, frequency, nocturia, incomplete bladder emptying, and weak urine stream. Today, I am talking about benign prostate hyperplasia, otherwise called BPH, and also called prostate gland enlargement. Let's see what are the causes of prostatic enlargement, what are the symptoms and how to diagnose prostate enlargement, and the method of treatment of prostate enlargement. Now, video on various medical topics in English language are released on this channel every Thursday at 11 a.m. To regularly receive informative video like this one, subscribe to the Eva Medical Series channel and click on the bell button and turn on all option. And don't forget to share and comment. The prostate gland is located just below the bladder in men and surrounds the top portion of the tube that drains urine from the bladder called urethra. The prostate's primary function is to produce the fluid that nourishes the transport sperm. The prostate is a small, soft organ. On an average, it is roughly the size of a walnut and weigh around 30 grams and is usually soft and smooth to the touch. The prostate sits deep in the pelvis between the penis and the bladder. It is possible to feel the prostate gland by placing a finger into the rectum and pressing it towards the front of the body. The urethra, a tube that carries urine and semen out of the body, passes through the prostates. The primary function of the prostate is to contribute prostatic fluid to semen. During ejaculation, sperm moves from the testis through the tubes called the vas deferens into the area of the prostate. At this point, the prostate contracts, closing off the opening between the bladder and the urethra, releasing fluid into the urethra and pushing the semen on through. The fluid excreted by prostate make up about 1/3 of the total volume of semen and contain various enzymes, zinc and citric acid. One important enzyme is prostate-specific antigen, in short it is called PSA, which help make the semen thinner and more fluid. Benign prostatic hyperplasia is the enlargement of the prostatic gland mainly seen in men and aged above 50 years. It has been observed that 8 out of 10 men have prostate enlargement. It is mainly caused due to overgrowth of the benign glandular tissue and leads to uncomfortable urinary symptoms. The severity of symptoms in the people who have prostate gland enlargement varies, but symptoms tend to gradually worsen over time. Common signs and symptoms of prostate gland enlargement include frequent of urgent need to urinate, increased frequency of urination at night, otherwise called nocturia, difficulty in starting urination, weak urine stream or a stream that stops and starts, dribbling at the end of the urination, inability to fully empty the bladder are the common signs and symptoms of prostate gland enlargement. Urinary tract infection, inability to urinate, blood in the urine are the less common signs and symptoms of prostate gland enlargement. The size of the prostate is not dependent on the severity of its symptoms. Some men, only slightly enlarged prostate can have significant symptoms, while other men with very enlarged prostate can have only mild urinary symptoms. In some men, symptoms finally stabilize and might even improve over time. Sometimes, some other conditions can lead to symptoms similar to those caused by an enlarged prostate, which include urinary tract infection, inflammation of the prostate, narrowing of the urethra, otherwise called urethral stricture, scarring in the bladder neck as a result of previous surgery, bladder or kidney stones, problems with nerves that control the bladder, cancer of the prostate or bladder are the conditions and symptoms are mimicked as the symptoms of prostate enlargement. The exact cause of prostate enlargement is unknown, but it is believed that it might be due to changes in the balance of sex hormone as men grow older. But there are certain risk factors as there for prostate gland enlargement, which include aging, family history of diabetes, heart disease, and lifestyle issues. Prostate gland enlargement rarely causes signs and symptoms in men younger than 40 years of age. About one-third of men experience moderate to severe symptoms by their 60s, and about half of the men experience moderate to severe symptoms by their 80s. A blood relative having prostate problem, such as father or a brother with prostate problems, you are more prone to get prostate problems. Certain studies shows that diabetes as well as heart disease and the use of beta blockers drugs might increase the risk of prostate enlargement. And people with obesity increase the risk of prostatic enlargement. There are chances of certain complications of enlarged prostate. Someone having prostate enlargement may experience a sudden inability to urinate, otherwise called urinary retention. In such cases, you need to have a catheter inserted into the bladder to drain the urine. Some men with an enlarged prostate need surgery to relieve urinary retention. Some others experience urinary tract infection. They have the inability to fully empty the bladder can increase the risk of infection in the urinary tract. If urinary tract infection occurs frequently, you might need surgery to remove the part of the prostate. Bladder stones are sometimes generally caused by an inability to fully empty the bladder. Bladder stone can cause bladder infection, bladder irritation, blood in the urine, and obstruction of the urinary flow. A bladder that hasn't completely emptied can stretch and weaken over time. As a result, the muscular wall of the bladder no longer contracts properly, making it harder to fully empty your bladder. Pressure in the bladder from urinary retention can directly damage the kidney or allow bladder infection to reach the kidneys. Normally, most men with an enlarged prostate don't develop these complications. However, acute urinary retention and kidney damage can be serious health threats. Diagnosis of prostate enlargement is started by asking detailed questions about your symptoms and doing a physical exam. This initial exam is likely to include a digital rectal exam, urine test, and blood test. The digital exam is performed by the doctor inserting a finger into the rectum to check your prostate for enlargement. A urine test is recommended to help rule out an infection or other condition that can cause similar symptoms. A blood test is recommended to rule out kidneys problem, and a prostatic specific antigen blood test is also recommended. Prostate specific antigen, also known as PSA, is a substance produced in the prostate. PSA levels are increased in the individual having an enlarged prostate. However, elevated PSA level can also be due to recent procedure, infection, surgery, or prostatic cancer. Some additional tests are also recommended to help confirm an enlargement of prostate and to rule out other conditions. These tests includes the urinary flow test and post-voided residual urine test. In the urinary flow test, you urinate into a receptacle attached to a machine that measures the strength and amount of your urine flow. Test results help determine over time if your condition is getting better or worse. The post-void residual volume test measures whether you can fully empty the bladder. The test can be done using ultrasound or by inserting a catheter into your bladder after you urinate to measure how much urine is left in your bladder. In addition, the doctor may recommend you keep a 24-hour voiding diary. Recording the frequency and amount of urine might be especially helpful if more than one-third of your daily urinary output occur in night. If the condition is more complex, your doctor may recommend transrectal ultrasound. An ultrasound probe is inserted into your rectum to measure and evaluate your prostate, and also recommend a prostate biopsy. Transrectal ultrasound guides needle used to take a tissue sample of the prostate. Examining the tissue can help to diagnose or rule out the prostate cancer. A wide variety of treatments are available for enlarged prostate, including medication, minimally invasive therapies, and surgery. The best treatment choice depends on several factors, including the size of the prostate, age of the patient, his overall health, and the amount of discomfort experienced. If the symptoms are at a tolerable level, you might decide to postpone the treatment and simply monitor your symptoms. Medication is the most common treatment for mild to moderate symptoms of prostate enlargement. The options include alpha blockers relaxing bladder neck muscles and muscle fibers in the prostate, making urination easier. Alpha blockers usually work quickly in men with relatively small prostates. Dizziness and harmless conditions in which semen goes back into the bladder instead of out of the tip of the penis, otherwise called retrograde ejaculation, are the side effects of alpha blockers. The other option is 5-alpha reductase inhibitors. These medications shrink your prostates by preventing hormonal changes that cause prostate growth. This medication might take up to 6 months can be effective. Side effects include retrograde ejaculation. Sometimes your doctor might recommend taking a combination of an alpha blocker and 5-alpha reductase inhibitor at the same time if either medications alone isn't effective. The next treatment option is minimally invasive or surgical therapy. Minimally invasive or surgical therapy might be recommended if the symptoms are moderate to severe, or if the medication hasn't relieved the symptoms or there is a urinary tract obstruction, bladder stones, blood in the urine, or kidney problems. Minimally invasive or surgical therapy might not be an option if you have an untreated urinary tract infection, urethral stricture disease, a history of prostate radiation therapy, or urinary tract surgery having neurological disorders such as Parkinson's disease or multiple sclerosis. The prostate procedure can cause some side effects depending on the procedure you choose. Complications might include semen flowing backward into the bladder instead of out of through the tips of penis during ejaculation, otherwise called retrograde ejaculation, experiencing temporary difficulty with urination, urinary tract infection, bleeding, erectile dysfunction, and very rarely loss of bladder control. There are several types of minimally invasive or surgical therapies are available. Transurethral resection of the prostate is one among them. In this procedure, a lightened scope is inserted into your urethra and the surgeon removes all but the other part of the prostate. This procedure generally relieves symptoms quickly, and most men have stronger urine flow soon after the procedure. After this procedure, you might temporarily need a catheter to drain your bladder. The next procedure is transurethral incision of the prostate. In this procedure, a lightened scope is inserted in the urethra and the surgeon make one or two small cuts in the prostate gland, making it easier for urine to pass through the urethra. This surgery might be an option if you have a small or moderately enlarged prostate gland, especially if you have health problem that make other surgeries too risky. The next procedure is transurethral microwave thermotherapy. In this procedure, the doctor insert a special electrode through your urethra into the prostate area. Microwave energy from the electrode destroy the inner portion of the enlarged prostate gland, shrinking it and easing urine flow. This procedure might only partially relieve the symptoms. And the next procedure is transurethral needle ablation. In this procedure, a scope is passed into the urethra, allowing to place needle into the prostate gland. Radio waves pass through the needle, heating and destroying the excess prostate tissue that's blocking urine flow. This procedure may be an option in select cases, but the procedure is rarely used by any longer. The next option is laser therapy. A high energy laser destroy or remove overgrowth of prostate tissues. Laser therapy generally relieves symptoms right away and has a lower risk of side effects than does no laser surgery. Laser surgery might be used in men who shouldn't have other prostate procedure because they take blood thinning medications. There are various options available for laser therapy. Ablative procedure are one of them. This procedure vaporizes obstructive prostate tissue to increase urine flow. Example include photoselective vaporization of the prostate and holmium laser ablations of the prostate. Ablative procedure can cause irritating urinary symptoms after surgery, so in rare situation, another resection procedure might be needed at some point. The other option is enucleative procedure. Enucleative procedures such as holmium laser and enucleation of the prostate generally remove all the prostate tissue, blocking urine flow and preventing regrowth of tissue. The removed tissue can be examined for prostate cancer and other conditions. These procedures are similar to open prostatectomy. Another procedure is prostatic urethral lift. In this procedure, a special tag is used to compress the sides of the prostate to increase the flow of urine. This procedure might be recommended if you have lower urinary tract symptoms. The prostatic urethral lift also might be offered to some men concerned about treatment, impact and erectile dysfunction and ejaculatory problems, since the effects on ejaculation and sexual function is much lower with prostatic urethral lift than it is with transurethral resection of the prostate. Open or robot-assisted prostatectomy is another option. Here, the surgeon makes an incision in the lower abdomen to reach the prostate and remove tissues. Open prostatectomy is generally recommended in very large prostate, bladder damage, or other complicating factors. The follow-up care will depend on the specific technique used to treat the enlarged prostate. Limit heavy lifting and excessive exercises for 7 days if you have laser ablation, transurethral needle ablation, or transurethral microwave therapy. If you have open or robot-assisted prostatectomy, you might need to restrict activity for 6 weeks. Certain lifestyle changes might be helpful sometimes. To help control the symptoms and enlarged prostate, try to limit beverages in the evening. Don't drink anything for an hour or two before bedtime. It will help to avoid late night urination. Limit caffeine and alcohol. They can increase urine production, irritate the bladder and worsen symptoms. Limit decongestants or antihistamines. This drug tightens the bands of muscles around the urethra that control urine flow, making it harder to urinate. Pass the urine when you first feel the urge. Waiting too long might overstretch the bladder muscles and cause damage. Try to urinate at regular times, such as every 4 to 6 hours during the day. This can be especially useful if you have severe frequency and urgency. Follow a healthy diet. Obesity is associated with an enlarged prostate. Stay active. Inactivity contributes to urine retention. Even a small amount of exercise can help reduce urinary problem caused by an enlarged prostate. Always keep warm. Colder temperature can cause urine retention and increase urgency to urinate. In modern medicine, treatment of prostate enlargement is mainly with the drug and in milder cases and surgery in more severe cases. But in homeopathy has a big role to play in the treatment of prostatic enlargement. Homeopathy recommends the very best treatment for prostatic enlargement. With the help of homeopathic treatment, you can reduce the symptoms of prostate and restrict the progression of the prostate growth and help to back to its normal size. Homeopathic medicine like Baryta carbonica, Baryta muriatica, Digitalis purpura, Selenium, Calcadia carbonica, Conium maculatum, Sabal cerulata, Staphylos aureus, Thuja occidentalis, Pereira breva, Chimaphila umblata are the few important drugs among the many homeopathic drugs indicated for prostate gland enlargement. Well-selected homeopathic medicine can successfully control symptoms associated with the prostatic enlargement, and it may help to avoid surgical interventions. That's all about benign prostate hyperplasia, otherwise called prostate gland enlargement. New videos on various medical topics in English language are released on this channel every Thursday at 11 am and in Malayalam language every Monday at 11 am. To regularly receive informative videos like this one, subscribe to the Eva Medical Series channel and click on the bell button and turn on the all option. And don't forget to share and comment. Next week at the same time, on the same day, a new topic will come before you. Thank you and goodbye.
Thanks for watching.
Like,
Comments
share,
and
subscribe.